Okay, time for our third and final part of our lecture on Linton Chapter 5. So, by the end of this lecture, you should be able to describe the Centers for Disease Control and Prevention, the CDC, describe their standard precautions guidelines for infection prevention and control. You should be able to describe the CDC isolation guidelines for airborne, droplet, and contact precautions, all those types of transmission based precautions. You should be able to describe the CDC isolation guidelines for a protective environment as well. And you also should be able to tell the difference between humoral or antibody mediated and cell mediated immunity. And finally, by the end of our lesson, you should be able to describe the nursing care of patients who have immunodeficiency and of those with allergies, and also describe the process of autoimmunity. Medical asepsis are the techniques that we follow to help limit the spread of microorganisms as we're caring for patients. Often we call it clean technique. And hand washing is the number one most effective method to prevent cross contamination. So, hand washing every time we go in and out of a patient's room, hand washing every time we're changing between patients, every time we take off and put on a new pair of gloves. This is the number one most effective thing we can do to protect our patients. Then, in comparison to medical asepsis, we have surgical asepsis or sterile technique. And this is to really eliminate microorganisms from any object that comes into contact with the patient. So, this includes care techniques that prevent non sterile surfaces from coming into contact with the patients. So, during dressing changes, for example. So, anything that is not sterile cannot touch something that's sterile. And if it does, then it has to be started over again because the sterile field is then contaminated. With all of our patients, we're going to be utilizing standard precautions. And standard precautions are the infection control guidelines for hospitals and also for other healthcare agencies from the Hospital Infection Control Practices Advisory Committee, or the HICPAC, and also from the CDC. So, standard precautions are for all patients in hospitals, regardless of what other isolation status they might also have. So we use standard precautions whenever we'll have contact with the patient's blood, with their bodily fluids, secretions, except for sweat, excretions, broken skin, and mucous membranes. So we use them when we have contact with materials that are soiled or contaminated with bodily fluids or blood. And these are just the standard precautions you're thinking about. If I'm going to be dealing with these things, I'm going to put gloves on. I'm going to always wash my hands before and after. If I think that I might be in risk of contamination from someone who is bleeding actively or oozing from a wound, I might also choose to put a gown on to protect my clothing from it. It's the precautions that you use in common sense to help protect yourself from picking up whatever microorganisms might be on the patient. So, in addition to standard precautions, with some of our patients, we're going to have other transmission based or isolation precautions on top of that, depending on what illness they have and how it is transmitted. So, with each of these, we're going to put a sign on the door that explains to people coming in and out of the room what they need to wear to protect themselves while they're in the room. And then we also need to educate patients and families about what these precautions are and why we're doing them. So the first would be airborne precautions. And airborne precautions come with things like tuberculosis, measles, chickenpox. All these types of things are things that are spread airborne because they're tiny, tiny, tiny particles that just literally spread on the air. So here's an example of one sign that it might look like for something like this. For airborne precautions, providers and staff that go into the room are going to wear N95 masks because the N95 masks help to protect us from breathing in those airborne particles. And the door is also going to remain closed. In addition to keeping the door closed, it'll be a private room for these patients, and it'll be a negative pressure room, meaning that air will be coming into the room, not going out of the room, because if it's going out of the room, those airborne particles can spread through other areas of the healthcare facility. So we would be educating patients on all these things, as well as If they need to leave the room for any reason, like to go to x-ray or other testing, the patient would wear a surgical mask because the surgical mask helps to protect from those particles getting out. So another example of a different type of precaution would be droplet precautions. And droplet precautions are used for things that spread on droplets, like from sneezing or coughing, things like that. So examples of these would be things like diphtheria, rubella, pneumonia, mumps, things like that are caused by droplets. So these patients would also be placed in a private room, but the door can remain open in these rooms. And here's an example of one sign that might go on their door. Everyone that goes into the room, obviously, hand hygiene in all of these cases. And there would need to be nose, mouth, and eye protection to prevent droplets from getting into any of those areas. Now, for these patients, usually if you're more than 3 feet away, the droplets are unlikely to contaminate you. But regardless, you're usually going to put this protection on anytime you go into the room because, usually you're going to be getting closer than 3 feet when you're doing patient care. And again, for these patients who, if they have to travel outside of their room, they should also be wearing surgical masks when they go out. And then finally, our third type of precautions are contact precautions. So these are for any things that the transmission is done by direct contact. So things like multi-drug resistant organisms, major wound infections, Shigella, herpes simplex, scabies, those are the types of things that we're trying to protect ourselves from. So here's an example of one of those signs. Again, hand hygiene, gloves, a gown, and anything that needs to be used in the room, stethoscopes, thermometers, water pitchers, it needs to stay in the room. If it's gonna come out again, it needs to be disinfected properly with the right product because we don't want to spread that to anyone else. It's especially important if this patient has anything that you might get feces on, anything like that. Definitely make sure you have the gown on. These types of patients, like C. diff patients, all of these patients would have contact precautions. Now, one other type of environment that you might see with patients is a protective environment. These are for patients who are immunocompromised, who need to be protected from outside sources of infection. So these patients are going to be in single rooms with the doors closed. They're going to have HEPA filtration, directed room airflow, and the opposite of with airborne precautions, these patients are going to have positive pressure rooms where air is blowing out of the room. This is to help prevent any outside infectious diseases coming into the room on the air. These rooms will be sealed as much as possible, and the surfaces should be easy to clean. No carpet in the rooms, nothing like that. And no living plants or flowers, nothing that can proliferate fungi and spread infection that way to the patient. Another use of infection that you might see in the news once in a while is bioterrorism. Bioterrorism is the intentional use of microorganisms to cause death or disease. So, for example, this was the anthrax scare that happened in the early 2000s. Anytime a person or organization purposefully tries to transmit infection to cause hysteria or mass infection or weaken an economy or a system. Now, patients with immunodeficiency are going to be at a higher risk for contracting any of these infections. And some causes for immunodeficiency include infections, malignancies, autoimmune and chronic diseases. Some drugs can cause immunodeficiency, stress from aging, malnutrition, and burns can really decrease your immunodeficiency as well. So, when we encounter these patients, there's a number of different medical treatments they can receive. Sometimes they might need bone marrow transplant, and always they can benefit from reduced stress, from correcting any malnutrition that might be going on, and discontinuing any medications that are causing or contributing to the immunodeficiency, assuming, of course, those medications can be discontinued. Sometimes, as with cases of organ transplants, or tissue transplants, those drugs causing the immunodeficiency must be continued because they are allowing the body to accept and not reject the foreign tissue. And then nursing care with these patients, again, as always, is very meticulous hand hygiene. We want to be taking frequent vital signs on these patients, assessing them, making sure that they're not starting to develop an infection because they are more susceptible for them. Even a little tiny spike in fever in these patients can start to indicate that something is brewing. So that needs to be watched closely. We need to help encourage proper nutrition, their own hygiene. We need to encourage them to cough and deep breathe to help prevent any kind of pneumonia. And they're going to be on protective isolation in those rooms we talked about with the positive pressure. When a patient has hypersensitivities or allergies, things that might normally be considered to be totally benign, to these patients, their body recognizes them as antigens, something foreign to be attacked. So, something as simple as pollens or dust. These things the body might recognize in these patients as being an antigen that needs to be taken out, cleared out of the body. And so this will, in these patients, activate the inflammation response to one degree or another. So many medical treatments exist for these patients, but the number one thing to always remember is we have to protect the airway. So we have to make sure that they're breathing and they're getting proper oxygenation throughout all of this. So some ways to accomplish this are through antihistamines like Benadryl, bronchodilators, inhalers if it's an asthmatic type response, corticosteroids to help bring down inflammation. And then these patients can also have allergy testing done through skin testing, most commonly, where small amounts of allergens are placed into the skin with little pinpricks, and the amount of response is then gauged for each of them to help determine what they're most allergic to. And then from there, these patients can be desensitized to their allergies through small injections of these allergens. And they start with tiny, tiny doses and work their way up from there to get the body desensitized to these allergens and decrease the response that happens each time they're exposed. So it's really important with all of our patients that we are documenting any allergies that they have. They should be in the chart, and we should be assessing and documenting what their response is to these allergens and any mitigating factors if the patient knows them. Is it a real allergy or was it a cross reaction with another medication? Was it something that happened in childhood and they don't even remember they don't know or remember what happened to them? Things like that. Especially for true allergies, patients should have bracelets on indicating that they have an allergy. We need to watch for cross reactions to other drugs. And if they're already taking allergy meds, such as asthma medications, daily medications like Claritin, we should make sure we continue those for these patients and avoid whatever allergens that they may have. We need to teach them about their allergies, how to avoid them, how to care for themselves. And if they have anaphylaxis to any type of allergen, they need to make sure they have an EpiPen they carry around with them, and they need to be educated on how to use that. And finally, nurses should avoid wearing scent or anything that might cause sensitivity in our patients. When an allergic reaction is taken to an extreme degree, it causes anaphylaxis. Some common causes of anaphylaxis include antimicrobials, especially penicillin. You'll see lots of severe reactions to penicillin. Insect venom, especially bee stings, iodinated radioactive contrast media, which can be injected intravenously for certain studies, imaging studies, local anesthetic, and blood products. So you can see anaphylaxis to that as well. So with anaphylaxis, it is like a systemic extreme version of this inflammation pathway we've talked about. So it dilates all the blood vessels in the body and it increases permeability in all those blood vessels. So lots of fluid so the vessels are dilating, that decreases blood pressure. Fluid is going out of the blood vessels, decreasing the blood pressure even further. Inflammation is building everywhere, particularly it can affect the airways. So all these things can cause shock, it can cause difficulty breathing. So it needs to be attended to quickly. So some treatments we give for these patients if they're experiencing it, oxygen, keep their O2 levels up. epinephrine to help bring up the blood pressure, dopamine, volume expander, all those things help with the blood pressure, bronchodilators to expand the lung capacity at the moment, diphenhydramine to reduce that allergic response, corticosteroids to reduce inflammation, intubation if needed, as well as tracheostomy or mechanical ventilation, whatever is needed to protect those airways. And obviously, we would start with the least invasive method of protecting the airway and escalate from there as needed. So, the best nursing care we can give is to prevent this type of response in our patients. So, we need to be monitoring their allergies to prevent us from getting here. But if it ever does happen, it's important that we recognize it as quickly as possible and treat it as quickly as possible. Activate the emergency response. And then with these patients, even after the emergence moment has passed, they need frequent monitoring for a while to ensure that they are remain stable. We talked about autoimmune diseases just a tiny bit earlier. What happens in these cases is something activates the immune response in the body against itself. So, for whatever reason, the body starts to recognize itself as a foreign body that needs to be rid from the body. And unfortunately, different causes of these autoimmune diseases are really poorly understood. Sometimes it seems that it may be initiated by injury or infection or malignancy. There does seem to be some genetic risk as part of it. Certain populations are at a higher risk for autoimmune diseases than others. Certain medications might lead to development of autoimmune diseases as well. So for these patients, we focus medical treatment on corticosteroids, just things to help bring down the inflammation. So NSAIDs with the same idea in mind, and other immunosuppressive therapies, trying to suppress the immune system so it stops fighting against the body so much. And it's important for us to help give these patients adequate rest and hydration. Again, encouraging proper nutrition, enough protein, vitamins, help to prevent infection, especially if we have them on immunosuppressive therapies, because then they will be at increased risk for infection. And these patients can often really suffer from emotional health issues and need some help with coping skills, because it can be a shock and there's a lot of unknown for them, especially because so much is unknown in the medical field. And they often find themselves frustrated and discouraged as they try to seek treatment for their diseases. So, a big part of nursing care for these patients, in addition to providing treatment, is being there for them emotionally and psychologically, helping them as they try to cope. Let's look at an example of a patient with an autoimmune disease, and let's talk about our nursing care. We're going to come up with 5 interventions that we would prioritize for this patient, as well as the rationales behind them. So here's our patient. We have a 68-year-old female with rheumatoid arthritis who is wheelchair bound, and she's admitted to a skilled nursing facility. Her husband, who was her sole caregiver, died suddenly from a myocardial infarction. She has no relatives willing to provide care for her. She has severe joint deformities, experiences pain with mobility, and needs help to perform all activities of daily living. She tells the nurse that she doesn't want to live without her husband and is refusing all care. So let's take a look. We'll think about Maslow's hierarchy of needs to help establish what we can do and prioritize for this patient. So, at the base of our pyramid of the hierarchy of needs, we need basic things for survival. Now, this patient is refusing any of that care to help with her survival. So, in order to help her even accept those basic needs, my first intervention that I would personally establish would be a psych consult, because we need her to receive help in order to receive the interventions she needs to help her to stay alive. So, first intervention would be a psych consult to help her work through some of the things, these feelings of grief that she's having, these feelings of depression, and help her find a path forward. My next intervention would be helping her to establish the resources she needs to accomplish her activities of daily living. So, setting her up with visiting nurses, or for in a long-term care facility, anything like that that will help her be able to have the resources she needs to accomplish those activities of daily living. From there, my third intervention would be to better control her pain so she's not always experiencing pain with her mobility. Get her pain better under control, some of that chronic pain management that we talked about in the past to help keep her feeling better and be able to function better. My fourth intervention would be to help her find connection with whoever it may be. Maybe she doesn't have family that is willing to care for her, but it sounds like she might have family that at least is able to visit her and have a relationship with her and connect with her. So helping her to build those relationships, maybe make new relationships with other people in her facility, other people that she knows in the community, helping her to build that sense of connection there. And finally, my fifth intervention would be to help her reestablish her sense of self moving forward, that concept of ego integrity versus despair that we talked about before. Help her re identify for herself what her life looks like moving forward after all these big life changes that she has had and accept this new path for her life. Now, your interventions might look different than mine, but the important thing for this is establishing interventions that would help the patient deal with all the different levels of problems. So, physical, survival type problems, going to pain, then to more emotional, like feelings of acceptance and needs for love, things like that. So, the priority here is to establish different tiers of interventions to help the patient on all different levels. And one last question to think about here. We have a mother who takes her 3-year-old son to the pediatrician for treatment of symptoms related to an upper respiratory infection. The mother inquires as to why it seems that her son, who is in daycare, is always sick. What information about the types of immunity can the nurse provide to the child's mother? Well, first, I would explain to the mother that in daycare, there's lots of different infections that can be passed from the other children because they're young. They don't necessarily cover their mouths well when they cough or sneeze. They might leave tissues laying around. They might wipe their hands on things. They put things in their mouths. And all these things can transmit infections. And so it's very easy for kids to get infected in daycare. On the other hand, I would explain to her how every time her child is infected with one of these antigens, then his body then is developing antibody to that particular antigen. So it will help to protect him the next time he is exposed to that particular antigen again. So there's pros and cons to being in daycare. Yes, children are exposed to many different illnesses and diseases there, but conversely, they then develop many antibodies to things that they might not otherwise develop.